Hi, Katie.
Hi.
My name is Dr. Matt. I'm going to do your dental exam today.
Okay.
Can you please verify your first and last name?
Sure. It's Katie ASMR.
And then date of birth?
March 23rd, 1989.
Perfect. Do you have any allergies to medications?
Not that I'm aware of, no.
Okay, so I'm going to ask you a few questions to make sure that I have all your history, and then I'm going to lay down and do the dental checkup.
Okay.
When was your last dental exam?
It was about 4 months ago.
Okay, do you have any root canals?
Yes. Yes, I have one on my back left. Yeah.
Do you have any dental implants?
No.
Are you experiencing any pain or discomfort?
TMJ. Yeah, this side of my jaw is just very misaligned. I have like some kind of knot here that's developed because of it, I believe. It's just something's very off. There's clicking, popping. Sometimes it's hard to open my mouth, and just general pain when I'm chewing food.
Okay. So I did see that you brought in some scans, and I did take a look at them. It does show the cyst. It doesn't look like it's suspicious or anything. It looks normal.
Okay.
I'm going to go ahead and do my exam as well and see what we can recommend for you. On a scale of 0 to 10, how would you rate your pain?
TMJ pain? Right now it's about like a 6, but when I'm chewing food, especially hard food, it gets to be about a 9.
Okay. Are you on any medications on a daily basis?
Yes, I'm on a 75 milligram bupropion
Okay.
and 100 milligram trazodone at night.
All right. Have you experienced any kind of soreness inside the mouth? Any open sores?
No, no open sores, nothing
Okay.
like that. No.
Any tooth pain, toothache?
I've had that in the past, but it's all been fixed with dental work, so there's nothing currently that's aching.
Okay. And sometimes are you noticing any like abnormal taste or smell that comes out of your mouth?
Sometimes.
Even like a rotten kind of smell?
Yeah. Sometimes I smell something foul, and
Okay.
yeah, there's no reason for it. And I feel like it's coming from a tooth or my mouth or something.
It might be like a stone that's impacted in your tonsils. So we're going to go ahead and check those and see if that's the case. All right. Perfect. And your last x-ray was also 4 months ago. There is no reason to do one today, but you did have more than 6 months in between cleaning, so we're going to do one. All right. I'm just going to have you lay down and I'm going to start the exam.
Okay.
Okay, I'm going to apply fresh gloves. Okay, I'm going to give you these glasses to put on.
Okay, thank you.
going to start by palpating your face first. Looking at a TMJ. And I'm going to try to locate that cyst. You said it's on the right side, correct?
Yeah.
And if I'm noticing anything else extra, I'm going to go ahead and, okay. Definitely, I feel that. It's very, very tiny. And it hasn't grown, right? Since you noticed it. That's good. So TMJ stands for temporomandibular joint dysfunction. And the best way to diagnose this disorder is by performing an MRI of the joint. We can definitely do that after this exam. And once we diagnose it and we classify it, make sure that we know exactly what stage it is, and we can implement a program that will help to build the disc back up. And that usually helps with decreasing the pain. I'm going to place my fingers here. Let me know if you feel any pain. Okay. Okay, so go ahead and slowly open your mouth all the way. All right, and close. Definitely, I heard that click. Come back to center. All right, one more time. Open your mouth and close. Go ahead and open and close. Okay. So what I'm going to do first, I want to make sure that the teeth do look good and they are intact. Okay, go ahead and open your mouth. So you're going to feel kind of like a tapping sensation. Looking in the glands as well. I'm going to start with the one in the back, the right side. Okay, if you experience any kind of pain, feel free to let me know. You can raise your hand up and we can stop. There's definitely a buildup of tartar. And how often do you brush your teeth?
Twice a day.
Okay. That's very good. Yeah, we definitely want to do that at least twice a day. And do you use fluoride?
I think so. I use Crest Optic White.
Okay. That's perfect. Alright, and do you also floss?
No.
Yeah, I can definitely tell. It would be really good if you go with the floss in between your teeth. You know, the food doesn't really get stuck in between there and definitely causes less tartar to be built, but I'm not seeing any cavities, which it's a good sign so far. Okay. So here it looks really good. Let's go ahead and check the upper teeth. Oh my gosh, it's been a very long time since you've been at the clinic. Last time you were here, you just got a puppy.
Mm-hmm.
Okay, there is one tiny spot here that only after cleaning we're going to be able to see if it comes out. It might be just a stain. So how's the puppy?
Good. You're so cute.
That's awesome.
Mm-hmm.
Yeah, she was really lovely when you brought her here in the clinic.
Mm-hmm.
Okay. Alright, I'm gonna go ahead and sanitize these. And clean your teeth first. Okay, perfect. Perfect. Looks like the tartar is coming out. Okay, go ahead and open. Go ahead and spit. Okay. And the upper side. Okay. So what I'm gonna do now is I'll check the protrusion of your molars. So we're looking for misalignment of the jaw. And I'm going to use this blue paper to see exactly how your teeth are lying. So go ahead and open. Gently squeeze. Rub it front and then back. Slide it front and back. Good. And now open. And go ahead and open. Alright. That looks good. Alright, and now we're going to do the same thing on this side. Go ahead and close, slide it back and front. Good. And open. Okay, now we're going to do the same thing, but just slide it left to right. Left, go right. Okay, go ahead and open. Open. All right, and we'll do the same thing on the right side. So close, left and right. Okay, good, open. Right. Open. All right. I have this cream. It's called Magic. It has anti-inflammatory and muscle relaxant. So we're just going to go ahead and kind of like rub inside the cheek. We're going to go on the left side first. So go ahead and open. It's going to feel a little bit mentally, okay? Any pain here?
No.
What about here?
No.
What about here?
A tiny bit, yeah.
Okay. So I'm just going to go ahead and rub that in for about 10 seconds. And we'll do that same process on the right side as well. Any pain? Okay. All right, so that looks good. Now we're gonna try to leave that in. I'm going to remove this. And then you mentioned that you would like to do a whitening process.
Yes.
All right, so what we're going to do first, we're going to set you up with a guard. So first I want to make sure that this fits your mouth. Go ahead and try to open. It's a little bit too big, definitely. So let's go ahead and try something a tiny bit smaller. All right, how's that?
Good.
A little bit better. Okay, so I think this is the size that we're looking for. And our office uses My Smile. It works in about 10 minutes. It's non-sensitive and it whitens up to 10 shades. So let's go ahead and see exactly what we can do. I'm going to have you open your mouth. I'm going to try to insert this. Perfect. Close. I'm just going to try to fit your lips around it to make sure that you're comfortable. How is that? Is that good? Okay. Perfect. So we're just going to go ahead and turn it on. We're going to leave it for about 10 minutes. In the meanwhile, I'm just going to go ahead and check your lymph nodes. So we're talking preauricular lymph nodes and postauricular. The cyst that you have is definitely not a lymph node, because otherwise it would have shown on the CT scan. And submental. Okay, so what I'm going to do is I'll go get some cream that is on the same base, anti-inflammatory and muscle relaxant, and we're going to go ahead and rub it on the outside of your TMJ. So it's going to feel a little bit wet. It's on the right side, right? That it hurts the most. Although it is definitely recommended to be applied on both sides. I'm going to write a prescription for this, and you can use it up to 4 times a day. Okay, I'm going to apply some cold pressure as well. Okay, I'm going to apply some gentle pressure on each side. It's perfect. So let's go ahead and remove this. It's been almost 10 minutes. And we're going to go ahead and rinse. Okay, so what I'm going to do is I'll spray some water. Go ahead and open. Okay, one more time. Perfect. All right, so let's go ahead and do one final check here. I'm gonna have you open your mouth. I'm just going to go ahead and remove these. Okay, looks good. And that was definitely just a stain. I'm not seeing anything concerning on the upper side. Good. You're not experiencing any sensitivity after the whitening kit? Perfect. Okay, so let's go ahead and remove that. Okay, thank you, Katie, for coming in. Don't forget to pick up your prescription from the pharmacy, and I'll see you back in 6 months. Let's go ahead and make that appointment now.
Okay.
All right?
All right, thank you.
You're welcome.